Hello everyone, welcome to our 18th month progress report. My name is Caroline Kelly and my topic is investigating the correlation between oral health and comorbidities. I'm a PhD student and dentist with the Department of Restorative Dentistry and Endodontics. My supervisors are Zsolt Lohanai, Beata Karami, and Eniko Szabo. My SMS is Alex. My mission is to reduce the number of comorbidities associated with oral lesions. My vision is to educate the population on the importance of oral health and the impact it has on our general health. I have two goals. My first goal is investigating the prevalence and odds of Porphyromonas gingivalis in cardiovascular samples. My second goal is investigating the prevalence of periodontitis-related oral bacteria in cardiovascular samples. And my topics are systematic reviews and meta-analysis. So my PhD topic is very important as cardiovascular disease is responsible for the loss of 18 million lives each year. Periodontitis, which affects up to 50% of the population, is associated with an increased risk of cardiovascular disease. The more severe the periodontitis, the higher the risk of developing cardiovascular disease. So our aim is to determine the prevalence of Porphyromonas gingivalis in cardiovascular samples of adults with cardiovascular disease. Our first clinical question: what is the prevalence of Porphyromonas gingivalis in cardiovascular samples of adults with cardiovascular disease? Our population are adults with cardiovascular disease, and we investigated Porphyromonas gingivalis in cardiovascular samples by PCR or culturing methods. We then made subgroups based on the oral status of the patients, whether they were orally healthy or had periodontitis or were edentulous. We then made subgroups based on the location the vascular segment had been taken from. And our final subgroup was we made two groups according to the type of cardiovascular disease, whether it was dilatory or constrictory. Our hypothesis is Porphyromonas gingivalis colonizes in cardiovascular lesions of adults with CVD. Our second clinical question: does the presence of oral bacteria in oral samples increase the risk of oral bacteria colonizing in cardiovascular lesions? So our population are adults with cardiovascular disease. We have a group of patients with a positive oral bacterial sample and a group of patients with a negative oral bacterial sample. And our outcome is oral bacteria in cardiovascular samples of adults with CVD detected by PCR or culturing methods. Our hypothesis is oral bacteria found in oral samples increases the odds of detecting oral bacteria in cardiovascular lesions. And here you see our search key which we used, and the databases which we searched in were PubMed, Embase, and Cochrane. And as you can see from this flowchart, we initially begun with 16,260 articles, and we ended up with 63 eligible full texts. Okay, and to answer our first clinical question, we had 3,050 cardiovascular samples, which were obtained during cardiovascular surgery. 706 of those samples were positive for Porphyromonas gingivalis, and the proportional prevalence of Porphyromonas gingivalis is 15%, heterogeneity 81%. Okay, and then we made a subgroup analysis according to the oral status of patients. So we had patients who were orally healthy, those with periodontitis, and those who were edentulous. So in orally healthy patients, the prevalence of PG in cardiovascular samples was 7%. Those with periodontitis, the prevalence of PG in the cardiovascular samples was almost triple at 18%. And here you see the results according to vessel subtype. So we had the heart, coronary artery, aorta, carotid artery, inferior extremity arteries, and pooled arteries. We also had mammary arteries. Unfortunately, there were not enough articles for statistical analysis of the mammary arteries and the heart samples. And according to our odds results, so those patients who tested positive for PG in the oral cavity have 8 times higher odds of detecting PG in their cardiovascular samples compared to those who were orally negative for PG. So here is a summary of the prevalence of PG depending on the vessel sample location. The coronary artery had the highest prevalence at 34%, followed by the inferior extremity artery 17%, aorta 10%, pooled artery 6%, and finally the carotid artery showed the lowest prevalence at 5%. Okay, and the strengths of our studies were that there was a great number of articles included. Subgroup analysis was made for several conditions. All of the included articles had rigorous methodology described and followed. However, the limitations were that sometimes the CVD diagnosis was not very clear. The individual patient data was not always given. Results were pooled in a number of articles, and periodontal stages were not well defined in the articles included. Okay, our conclusion is that even a small amount of oral pathogenic bacteria found in CV samples could have a clinical significance. Our data shows that the coronary arteries are the most susceptible to PG compared to the other arteries which we investigated, and eliminating oral lesions and oral pathogenic bacteria may prevent or even slow the progression of CVD. Our implication for practice: as a complex approach, before CV surgery, patients should be sent to the dentist for periodontal treatment and the elimination of oral lesions. Antibiotic prophylaxis should be considered if the patient has periodontal inflammation. However, this might lead to antibiotic overuse. Further investigations are necessary to clarify the exact indication for the use of antibiotics. Our implication for research is to further investigate the PG-related pathomechanism of CVD and to evaluate the effect of periodontal treatment. Okay, so we are currently writing our manuscript. In the previous 2 weeks, we were writing our manuscript and we received the final results. And next 2 weeks, we will continue with the manuscript. My second topic concentrates on the prevalence of other periodontitis-related bacteria. Here you can see the periodontal bacteria we're focusing on circled in red. And our clinical question is similar to our first with exactly the same subgrouping. And regarding our progress, we have to do risk of bias still. And since our search had been conducted 1 year ago, possibly we might run our search one more time. So we hope to finish and submit our first topic by March 25 and our second topic by August 25. And thank you so much for your attention. I'd like to finish this presentation with a quote by Thomas Berger: "The art and science of asking questions is the source of all knowledge."